Hi, Lauren Brown here. I'm the clinical director of AcuBalance Wellness Center. I'm a doctor of traditional Chinese medicine, and our website's acubalance.ca, and you're watching Fertility Now. And my intention is to share fertility concepts and ideas and make them as simple as possible. I want to talk about luteal phase defect and spotting before your scheduled menstrual cycle would be. So the luteal phase is the second half of your cycle. So after ovulation, that would be considered your luteal phase. And in a normal cycle, you have the first half of your cycle, it's the follicular phase, dominated by estrogen, your lining grows, your follicle matures, and it gets released. And upon ovulation, so let's pretend this is my follicle and this is my egg. So they are once one, the follicle and egg are together, and you release the egg. So the egg goes to the fallopian tube, hoping to meet a sperm if you're trying to conceive for fertilization. And the follicle stays on the ovary and becomes the corpus luteum. Hence the yellow belly is the name of it, is the yellow belly, and hence the name luteal phase for the second half of your cycle. And this progesterone, so the follicle and egg were once one, and now this follicle is on the ovary, it's producing progesterone. That's why your temperature will go up after you ovulate if you're charting your basal body temperature, because progesterone is thermogenic. And part of its job is to prepare the lining for fertilization for an embryo to implant. So it helps with the window of receptivity for implantation, and it maintains your lining. When progesterone drops, so if there is no pregnancy and progesterone drops at the end of your cycle, your lining will shed. You'll have your menstrual bleed. So what I want to share with you, why luteal phase defect could be an issue, it's a thought I have around egg quality of how to possibly assess the egg quality indirectly. Now, I'll share with you that once upon a time, many years ago, I was speaking to an IVF doctor, a reproductive endocrinologist, and I was sharing about a mutual patient, how we want to help lengthen her second half of her cycle because she has luteal phase defect. She was bleeding like 9 days after her ovulation. And his response to me was that, Lauren, we don't care about that because luteal phase defect went out in the 1980s. And I'm sure it's because they use ovulation drugs to try and make your body release more eggs, so maybe more progesterone, and then IVF, they supplement you with progesterone. But my goal at my clinic is to help my patients either conceive naturally or have success with their IVF and have a healthy baby. So we want that egg to be at its maximum potential. So I couldn't let it go, the luteal phase defect, because it is an issue in Chinese medicine. It's an issue if your cycles are short. If you're having less than 26-day cycles, assuming you're ovulating on day 14, in Chinese medicine, that's considered short. And in naturopathic medicine as well, they still concerned about a luteal phase defect and like to see these balanced hormones and regular cycles of textbook 28 days. And the most important part, or it's important that after ovulation, regardless of when you ovulate, do you have a 14-day luteal phase? Plus or minus 2 days is the average. So 12 to 16 days is a common luteal phase for women. So why do I care and what I wanted to share with you is just a simple idea of why I think it's another way or a way for us to kind of assess maybe we're not helping that egg reach its maximum potential. And there's things that we can do to support the body on a cellular level so we can help maximize that egg quality so it reaches its peak fertility potential, whether you're trying to conceive naturally, so at the time of ovulation, or through an IVF cycle. So I was thinking about Chinese medicine, Yin Yang Theory. So this is how this came to me. And I shared this idea with another reproductive endocrinologist. And he actually thought that there was cool science around the physiology of the follicle and egg, that what I was sharing made sense. So we think this makes sense. It doesn't mean what we're saying is we know it. Know it means we have science and studies, evidence to support it. We don't have that, but we definitely have the science and the mechanism to say that this is a possibility. And for me, that's why we want to see you have nice, healthy 28-day cycles and at least that 14-day luteal phase. So the egg and sperm, the egg and follicle are once one. So we're going to pretend this is my follicle and this is the egg. And they're once one. The egg is inside the follicle. And the follicle's role here is to nourish and support the egg during its maturation process. And if the follicle is not a good egg house, in Chinese medicine, I think egg house because it's called the baby palace, the Zigong baby palace idea is a name of an acupuncture point above the ovaries. So, and I've heard another reproductive endocrinologist at a public talk use a layman's term, call it the egg house. So the egg house, if you have a good house, you can get a good egg, he says. And so it's important that the health of the follicle, good blood flow, good nourishment, good mitochondria health, that's the batteries of the cell, the mitochondria produce energy. He says we want that to be awesome because that will help during the recruitment phase for the egg to reach its potential. And so if the egg and follicle are once one, and then the egg gets released at ovulation or in an IVF pickup, the egg is taken from the follicle and it goes in a natural cycle into the fallopian tube to meet a sperm if you're trying to conceive and hopefully fertilize. And then this follicle stays with the ovary and collapses and becomes what's known as the corpus luteum, meaning yellow belly, and corpus luteum, hence the luteal phase. That's where the name comes from for the second half of your cycle. It stays on the ovary to produce progesterone. And progesterone's role is to prepare the lining for implantation from an embryo. And so it's important for that implantation window that you have progesterone. And it maintains the lining. So if there is a big drop in progesterone, which happens if you're not pregnant by the end of your cycle, you will have a bleed. So when progesterone drops, your lining sheds. And so I was thinking, if these were once one, the follicle and the egg goes to meet the sperm in the tube or into the lab for an IVF, and the follicle or in a natural cycle or follicles in an IVF setting are on the ovary. And in a natural cycle, this corpus luteum basically dies like after 10 days, evident by all of a sudden a bleed. So it doesn't have the ability to produce progesterone, enough progesterone or progesterone for 14 days. Then I'm questioning the health of this follicle. And since it's the follicle that's housing the egg, that's supporting it, nourishing it, then if it's not strong enough to last on its own for 14 days, then maybe it's not healthy enough to give the egg exactly what it needs so it can reach its peak fertility, its maximum egg quality. And so that's why in Chinese medicine and naturopathic medicine, we do have concerns if you are spotting leading up to your bleed after ovulation. And we do have concerns if you don't have a 28-day cycle, or according to Chinese medicine, if your cycle is less than 26 days, assuming you ovulate on day 14. So I get really concerned if it's like 10 days or less. 12 days is kind of a common thing we do see with the women we see in our practice. Once you start getting 11, 10 days, I think there's opportunity to improve your overall health on a cellular level and to improve the follicle health. So hopefully it can go 14 days. And then therefore during that recruitment stage and leading up to ovulation, it's able to nourish. That house is good, the follicle, it's able to nourish that egg. So whether it's an IVF or a natural cycle, it has a chance to reach its peak potential. And so that's why we will do what we can to support your body so your corpus luteum, your follicle, reaches its peak potential so it can support the egg. So maybe luteal phase defect went out in the 1980s for some clinics. At AccuBalance, we're always looking at helping you reach your peak fertility potential. So maximum egg quality, maximum sperm quality, and healthier environment. Whether you're trying to conceive naturally or with ovulation drugs or with IVF, we want the building blocks to be at their peak potential, to be at the best that they can be. And one of the things I was thinking is if we're seeing a lot of spotting or short second halves of your cycle, maybe then the egg is not reaching its ideal potential. And so let's see if we can correct that. I will share with you, there are many reasons for spotting. And so please do seek out, talk to your healthcare provider, talk to your gynecologist. There are many reasons for spotting not related to the corpus luteum. So do check out with your gynecologist, see your local acupuncturist, or your naturopathic physician, and make sure you have your thorough investigation. And if you're trying to conceive, please check out other videos that we've put together on Fertility Now. Hopefully this is simple and easy to understand. And if you have questions, please send them our way. Thank you.